Hi, Courtney.
Yes.
Nice to see you again.
Nice to see you.
So I'm Jamie. I'm the nurse practitioning student that's going to be with you today. Can you state your full name and birthday for me?
Courtney Marie Corby, 10792.
Great. So today I'm going to complete a cognitive exam on you, okay? It's going to be a series of questions. They might seem silly. Just try and answer them the best that you can, okay? Do you have any concerns about your mental health or your mental state right now?
Nope.
No. Have you had any history of head trauma?
No, I have not.
Okay. So have you been feeling sad, irritable, overwhelmed lately? No. Okay. So what day of the week is it right now?
Monday.
All right. Do you know what the date is?
November 3rd,
Perfect. And what is the year?
2025.
And what season are we in?
All.
All right. What country are we in?
The United States.
And what county are we in?
Dickens.
What about town?
Air Mountain.
Building?
Marshfield Medical Center.
And what is the ward?
Outpatient clinic.
Perfect. So I'm going to ask you to complete my analogy here. So a dog is to a puppy as a cat is to a
Kitten.
And if I said that you were a night owl, what would that mean to you?
Staying up late.
Okay, so I'm going to have you count backwards from 100 by sevens, okay? So you're going to start by subtracting 7 from 100, and then we're going to continue the pattern for 5 subtractions.
Okay.
All right.
So 100, 93, 86, 79, 72, and 65.
Perfect. Okay, so on this card right here, you can take the blue marker. I want you to write this sentence. I like to walk my dog.
My dog actually ran away yesterday.
Oh no.
Mm-hmm.
I am going to tell you, good job. We'll just hold that now. I'm going to tell you 3 words. Can you repeat them to me? Apple, pen, table.
Apple, pen, table.
Perfect. Can you tell me what you had for breakfast yesterday?
I did not eat breakfast yesterday.
Okay. Can you tell me what year you graduated from high school?
2011.
Okay. Have you had any difficulty like staying focused or staying on task lately? No. Good. So if your house was on fire, what would you do?
Get out and call 911.
All right. And can you tell me the words that I asked you to repeat a few moments ago?
Apple, pen, table.
Perfect. So what is this?
That is a spider pencil.
All right. And what is this?
A watch.
Perfect. Can you repeat after me? No ifs, ands, or buts.
No ifs, ands, or buts.
Perfect. Okay, so I would like you to take this piece of paper right here with your right hand, fold it in half, and place the folded piece of paper on the table in front of you.
Do I have to fold it one-handed?
No, you can fold it with both hands. Perfect. And on this piece of paper, I have written something that I want you to do. Can you read it and do the activity?
Read it out loud.
Just read it to yourself. Perfect. And the activity was to clap your hands. So, and then lastly, you're going to use that marker there. I have another blank piece of paper. Can you copy this image right here?
Not the best at my angles, but
It's okay. All right, and she had accurately drawn intersecting pentagons here. Have you had any difficulty speaking or expressing your thoughts lately?
Nope.
No. And have you had any trouble understanding or following conversations?
No.
Have you been feeling anxious or excessively sad?
Nope.
Have you had any racing thoughts, confusion, or intrusive thoughts?
Nope.
And have you been experiencing any hallucinations, illusions, or just unusual sensory experiences?
Nope.
Okay. So I'm just gonna do a quick recap here, Courtney, on things that I had observed and what all this tested, okay? So you are alert and oriented to person, place, and time. You are well nourished, you're appropriately dressed, you don't appear to be in any acute distress to me today. You're neatly groomed, your hygiene appears appropriate and adequate. You have a relaxed posture, there's no signs of discomfort or agitation. Your affect is completely appropriate to context and there's no signs of distress today. You sustained attention, you followed conversation, and you responded appropriately to me. Your speech is logical and coherent today. Your communication pattern, it's very clear and appropriate. There is no abnormalities noted in that. Your voice is clear and steady today. The volume and tone is appropriate for our setting, and then you have normal rate of speech as well today. Your speech is well articulated. I don't hear any slurring or difficulties noted. You do not have expressive or receptive aphasia. You demonstrate a full understanding. You respond accurately to any questions that I've asked today. You report feeling well right when I met you, and your affect is definitely congruent with that mood. You show that your thought process is logical and organized today. You are not showing any signs of hallucinations, illusions, or delusional thinking to me. When we were doing all these tests, you were fully oriented to time, place, and person today. You interpreted correctly analogies, and it told me that your abstract thinking is intact. You demonstrated appropriate conceptual thinking as well today. You performed basic calculations correctly. You wrote legibly and appropriately. Your gross and fine motor skills and movement seemed to be intact. And then when it came to your memory, you accurately recalled information immediately. You remembered events and details recently that occurred, and then you also demonstrated intact long-term memory, okay? And then throughout this entire exam, you've maintained focus throughout the assessment, so no distractibility was noted. So what does this all mean, right?
Mhm.
So based on all of this information, Courtney, your mini mental health examination score is a 30. And so what a 30 means is that your cognitive function is completely and fully intact. And so it shows that your memory, your attention, your language, and your orientation are all functioning as they should be. And I have absolutely no concerns at this time. So do you have any questions or concerns for me today?
Not right now.
All right, sounds good. Well, thank you for your time.
Thank you.